Do I need to fast for lymphoma blood tests? When it comes to blood tests for lymphoma, many people wonder if they need to fast beforehand. In most cases, fasting is not required for these tests. Patients are typically advised to eat normally before their blood tests unless their healthcare provider gives different instructions. Most blood tests used for diagnosing, staging, or monitoring lymphoma do not need fasting. However, there are some exceptions. Certain blood tests may require fasting for 8 to 12 hours before the test. This is particularly true for tests that measure substances affected by food or drink, like glucose or certain lipids. If fasting is necessary, your doctor or nurse will provide specific instructions about how long to fast, what you can drink, usually just water, and whether you should avoid medications or certain foods before the test. To prepare for lymphoma blood tests, staying well hydrated is a good idea. This can make the blood draw easier. It is also wise to avoid alcohol and tobacco before the test, since these substances can affect some blood parameters, including liver enzymes and white blood cell counts. Additionally, inform your healthcare team about any medications, supplements, or recent illnesses, as these can influence test results. It is important to understand that factors like stress, infections, or inflammation may alter blood counts. These should be discussed with your doctor as they can impact the accuracy of your test results. Since lymphoma blood tests are often repeated during diagnosis, treatment, and follow-up, your medical team will guide you on any specific preparation needed for each test. If you ever feel uncertain about whether fasting or other preparations are required, do not hesitate to ask your healthcare provider ahead of time. This will help ensure that you get accurate and reliable results. In summary, fasting is generally not necessary for lymphoma blood tests unless your medical team specifically instructs you to do so. Always follow the preparation guidelines provided for your specific test to support accurate diagnosis and monitoring.